It's my job to give you a little more practice on coding injuries, those 7 characters. We'll talk a little more about that and sequelas. This is not a long discussion, but very important. I hear all the time people are confused about sequelas and these injuries, etc. So I'm going to take a moment to break it down for you. First things first, we're going to practice coding an injury, and we're going to start with a scenario. Very briefly, what is the ICD-10-CM code for a patient who arrives to the ED for treatment of an open wound to the neck? All right, so because this is a demonstration, we are going to walk this together. So let's talk. Well, first, we have to code for an open wound to the neck, and we need to know what is open. Well, just know if the wound is not producing any blood or tissue, if you can't see blood or tissue, then it's closed. That's a closed wound on the left and an open wound on the right. Next, we're going to look the code up in the ICD-10-CM index, right? So the first thing that we have to determine is, what is our main term? So go ahead, type in the chat, let me know what the main term is for open wound to the neck. Good deal, good deal. All right, so the main term is wound open. Wound open, you're going to see in a moment, because wound, if you think about it, is a diagnosis that can actually stand alone. Now, what is or are there any subterms? Go ahead, type in the chat. Yes, somebody said it. Yeah, the subterm is neck, right? So I got ahead of myself, but on the right, if you go to wound, just above it, there's wound check. That's not applicable, but wound open is. And it's important for us to know what the subterm is, because that's going to help us know where to go next. So we can't just can't code wound open. There's more to the story. Where is it? Where is that open wound? And that is our subterm, neck. So we're going to scroll down the page until we find neck. All right. And that takes us to code S11.90. And then there's a box with a check mark in it. And anytime you see that box with a check mark, that means that this code needs more characters. All right. So just know that the code is not finished. So the way we're going to get that information is going to the tabular list. So we're going to go find our boss, the S11 category, and of course, let's document our code, S11.9 with that check mark. And I also like to say that check mark means you're going to have to check that 7th character extender box. Yeah, often you will. Not always, but you may. So I like to say that check mark means that you may need more characters, and you may need to check the 7 character extender box. So we've learned previously that A is for initial encounter, D is for subsequent encounter, and S, that's for sequela. All right, I digress a little bit, but I'm back. Now let's start with the boss, S11, that tells us we're in the correct category, open wound of the neck. And if we read underneath, it says code also for any associated spinal cord injuries or wound infection. Our documentation doesn't mention any of that, so we can continue until we get to subcategory S11.9. So if we look down, let's go ahead and go further right up underneath it, S11.90. We found our code, and if you look, there is a blue box next to it. And that blue box has a check mark, right? All right. So that there's a check mark, there's a small X, and then there's a seventh character, seventh. So that means that this code should be 7 characters long. But we have a problem because right now this code is only 6 characters long. So what do? Well, we know that we need to check that 7th character extender box, and we can get our last character because if this patient went to the ED for an open wound, we can code A, place the 7th character extender A at the end of it. But that's not long enough. S11.90A is only 6 characters. Well, if that blue box is a clue, there's a little X in there. And that X is going to help you mark the spot. In other words, that X is going to enable you to elongate the code. So if you look to the upper right, this is what your code will look like. S11.90, X marks the spot, and our 7th character extender A. That's our code. And that's how you apply this check X 7th box. Okay, that's your X marks the spot box. Okay. All right, so how do you feel? Yes, someone said the blue box means placeholder X. Indeed. Everybody good? Indeed. All right, so we're going to move on and we're going to try another scenario. All right. All right, so we have another injury. Patient arrives to the ED with a foreign body in the left ear. The first thing that we have to do, we have to determine what is the main term. Go ahead, type in the chat. Yes, yes, yes. And the chat is saying that the main term is foreign body. That's the word that's doing something, right? Yeah. All right, what is your subterm? Okay, ear. And you can have multiple subterms. And in this case, we do. So we have ear left. It doesn't mean that we're going to find those terms, but it will help us if we do need them. So we're going right to the index. We're going to look up foreign body. Then we're going to scroll down and look for ear external. There is no mention of laterality. So we're going to go right to the code T16 dash check mark. Oh, well, that means more characters are required. All right. So I'm going to let you all code this. So we're at the tabular list. The patient arrives to the ED with a foreign body of the left ear. We have said that this code is T16.2, check mark. And we see the 7th character placeholder blue box right there. All right, go ahead and code this scenario. All right, so we are moving a little slow. And yeah, we should have answered it by now. Yeah, or tried, right? Okay, so it's the same concept as the previous. We have the 7th character placeholder box, or your X marks the spot box, and that X means that you can use it because this code must be 7 characters long. Whenever you see that 7, it means that it must be 7 characters long. So select the correct code and make it 7 characters long. All right, that was a clue. And you all are rocking the chat. Outstanding. All right, so we know the first 4 characters is T16.2. Okay, we got a little ahead of ourselves. But that check mark says, hey, there are more characters needed, and we have a 7th character placeholder. So that means that this has to be 7 characters long, and this is how we do it. We will use the 7th character extender box for the 7th character. We know this is left ear per the documentation, so we're going to use the T16.2. And to make it 7 characters, we're going to give it 1X, 2 X's, and the 7th character extender of A will be last. It's always the 7th character. All right, so a lot of you got that right, and some of you needed a little hint and clue, and some of you had an aha moment, and remember, that's priceless. So you all okay? Everybody get it? Good. Okay, that is okay. You had an aha moment. All right, so now let's go on to our next subject. This subject will be sequela. All right, so if you're looking at all these movies, what do they all have in common? Anybody know? Yeah, somebody said, hey, these are sequels. They are. Superman 4, Die Hard 2, Jaws the Revenge, Caddyshack 2, etc. These are sequels. And that means that something had to come before it. You have to have a movie that happened first before you have a sequel. Same context as sequela. Sequela must have something that occurs first in order for the sequela to exist. I'm going to let that marinate for a second, and then I'm going to tell you about Julie. All right. All right, so here are some definitions first. A sequel comes after the initial, right? And think about the first movie, then you have the sequel. A sequela comes after the initial phase of an illness or injury, okay? And another name for sequelae or sequela is late effect. All right, so let me tell you about Julie. Julie broke her leg 10 years ago skiing. And today, 10 years later, this is Julie. She walks with a limp. Julie has a late effect or sequela related to her broken leg. Now, we're going to learn about some guidelines for sequela. And I think I understand why there is some confusion, but hopefully we'll clear it up really quickly. So I went to the General Coding Guideline number 10, sequela and late effects. And they say sequela is the residual effect or the condition produced after the acute phase of an illness or injury has terminated. There is no time limit when a sequela code can be used. The residual may be apparent early, such as a cerebral infarction, or it can occur months or years later, like Julie, right? Such as that due to a previous injury. All right, so they give you some examples of sequela, such as a burn, deviated septum, infertility, etc. Now, this is what I want to draw your attention to. Coding of a sequela generally requires two codes, and they are sequenced in the following order. First, the condition or the nature of the sequela is sequenced first, then the sequela code is sequenced second. I'm going to write that down. It requires a minimum of two codes, but at least two codes. That first code will be the condition or the nature of the sequela. That second code is called a sequela code. And that code looks like it's a 7-character code that ends with an S. If we think about Julie, you're going to code her limp first, because this is the nature of the sequela or the condition. And second, you're going to code the sequela code, that injury that ends with S, a sequela. It's not going to end with A because it's not happening now. It will be, you will use the S, 7th character extender. So if we code it out, it would look something like this. R26.89, S82.90XS. All right. How does that sound? Does it make sense? How you doing? Okay, somebody said yes. I got one yes. All right. So let's go ahead and let's practice a bit. On the right of the screen, we have some late effects or sequelae. On the left, you have your late effect or your sequela. On the right, you have your initial or your acute phase. So on the left, this is what happens after what happens on the right. Okay, so the left comes after the right. Now I want you to match each of these. So I'm going to tell you the late effect, and then I want you to tell me what the acute or initial phase is. All right. So if I say, I'll give you the first one. If I say aphasia, the inability to speak, is the initial phase more likely an injury to the spinal cord, third-degree burns, CVA stroke, diabetes mellitus, or fractured leg? Go ahead, type your answers in the chat. Good deal. You all are rocking. You know what they're saying? Somebody's saying stroke, stroke, stroke. Outstanding. That's indeed the acute phase, or could be the acute or initial phase of aphasia. Aphasia happens after a stroke or CVA, cerebral vascular accident. All right? Okay, so I'm going to read the next one. You tell me what the acute phase could be. Paraplegia. Go ahead, type your answers in the chat. Outstanding. They're way ahead of me. They're saying injury to the spinal cord. Outstanding. All right, walk with a limp. What's the acute phase? Type your answer in the chat. Okay, there's your clue right there. Okay. Outstanding. A fractured leg. What about scar contracture? Yes. Yes. Third-degree burns can cause scar contracture. And finally, peripheral neuropathy. What can cause that, or what can go before peripheral neuropathy? That's right, diabetes mellitus. You know what? She doesn't talk until I start talking. Okay, thank you. All right, good deal, good deal. So very good. So you kind of understand now what sequela is in terms of sequela coming after the initial illness or injury. All right, so I have, and these are the answers just to kind of show you. Now I got a scenario. Okay, your job is to tell me what is the sequela and what is the sequela code. Or you don't really have to code it. Just tell me which one is going to serve as the sequela, which diagnosis, sign, or symptom, or which diagnosis, sign, or symptom or is going to be the sequela code. All right. So we have Byron, who was involved in a motorcycle accident 3 years prior, where he has sustained a fracture of the lower left leg. Today, he presents with complaints of chronic pain and weakness in his lower left leg. All right, so we're not going to code this out. I want to know, what is the sequelae? What is the sequelae? Go ahead, type your answer in the chat. And remember, sequelae comes after the acute phase. Absolutely. You all got it out before I could even see what your answer was. It is the chronic pain and weakness in the lower left leg. That is the sequela. All right. And what is the sequela code? What would we use? What will we code with the sequela code? Good deal. I did highlight it too soon, but fracture of the lower leg. All right. We're going to sequence the sequelae first, and then we will sequence the sequela code, the condition that we're going to, the initial code. Okay, the initial incident, we're going to use coded as a sequela. So the initial injury will be coded as a sequela, and that will be sequenced second. Now, this is how you find these sequelaes, the sequela codes in your ICD-10-CM. All right, so what you're going to do is you're going to look up in the alphabetic index under the term sequelae or sequela and or late effect, either or, okay? It depends on how your book is laid out. So let's go ahead and code this out. So we've got a fracture to the lower left leg. We need the sequela code. So we're going to sequela, right? Sequela what? Then you scroll down until you find fracture. And then it tells you code to the injury with 7th character S. That's essentially what you're going to do. So we're going to look for fracture, traumatic, lower leg. And they give us S82.9, and we have some additional codes or characters. So we need to go to the tabular list. All right, so we're at the boss, S82, fracture of lower leg, including ankle. And if you look at this 7th character extender box, it is extensive. And so don't assume that you know what the 7th character extender is. But just so you know, the actual code is S82.92, unspecified fracture of lower leg, unspecified fracture of left lower leg. S82.92 X marks the spot. Our 7th character placeholder box told us that this has to be 7 characters long, and the guidance in your index told you, under sequela, told you to code the acute injury and use the 7th character S, sequela. So if we coded it all out, Byron's scenario or documentation would produce the following: G89.4, M79.66, and S82.92XS. So there you have a minimum of 2 codes. So it's more important that you see the logistics of how these sequelas are coded than to actually do it. And here's why. I've got another scenario, but before I move on, I want to make sure that you're with me. You all with me? Yes, I got 2 yeses. Let me know. Yes, okay. All right, we got a little more. Got it. That's right. Okay, so I got another scenario, and I want you to select the correct answer. All right. Of the following, which answer best describes the encounter? A. M25.611, L90.50, T22.051A. B. L90.50, T22.051A. C. T22.051S, L90.50, D. L90.50, T22.051S. Maria, a 30-year-old woman, visits the doctor's office due to a limited range of motion in her right arm following a severe burn injury 6 months ago. The physician diagnoses the patient with scar contracture of the right arm. To address the issue, the doctor recommends a series of physical therapy sessions and refers her to a specialist for possible surgical intervention. All right, you've got a couple of, I'm going to give you 30 seconds. What are you talking about, Mrs. J? Hey, if you follow the guidelines, you can answer this question. All right. What say you? Type your answers in the chat. Is it A, B, C, or D? And a lot of you are answering. So I'll give you the rest some time, a few more minutes. All right. Okay, a couple more moments. I'm hanging in there. I'm rooting for you. Come on. All right. So if you didn't answer it now, maybe you need a quick review. All right. So remember, the guidelines on your own. If you want to go grab your ICD-10-CM, go to the general coding guidelines. That's guideline B, number 10, Sequela, late effects. And then it will tell you that this requires 2 codes. The first code will be the condition or the nature of the sequela. The second will be your sequela code. That will be your initial phase incident with the 7th character S. So the second code, just so you know, is not the sequela, right? No, it's a sequela code. It's not the sequela. The sequela is the first one, right? It's the sequel. It's why often that you're coming to get the treatment, right? So if we look at all of the codes, A is coding for the limited range of motion. How do you know that, Mrs. J? Because it's an M, and this patient has scar contracture of the right arm. She's got a that's a L or a skin problem, and then you're getting really complex. And I'm going to let you know that when you hit part 2, you're going to know what those are. You are, and some of you kind of do. But that's not how I was able to solve this scenario. I was able to solve this scenario in seconds is because that second code has to end with 7-character S, right? Your sequela code has to end with 7-character S. A, B, and C, none of them are ending with the 7th character S, and only D is. That's how I knew what it was. All right. So how are you?